Hi, everybody. I'll disappoint you. There is no science coming today. But I just give an opportunity to tell you a little bit about our work, starting here from collaborations that we started a few years ago with Canon Medical, and how this has basically grew out to basically cover almost all the UK now into something very, very exciting. My name means Sotos, it means savior, not of your time. Anyway, it's a nice joke, right? Anyway, that's just me. So I think we all believe that there is hope that AI at some point will help relieve all the pressures that we face within the healthcare system, right? And I think the best evidence to see that is the growth. On this slide, you will see the number of AI or machine learning enabled medical devices going for approval within the FDA. So starting from the 90s, but basically what surprises you is the growth that you see in the last few years, the kind of like exponential growth, particularly in the area on the radiology sector. So lots of great things, but everybody hopes that at some point we will be able to create an AI that should be able to predict, it should be able to suggest, right? So it should be able to say that we can create an AI that by collecting some data of people that have presented to the hospital with a hip fracture, by collecting some additional characteristics about themselves, we can then be able to create an AI that can tell us what is the risk of disability within a few years, right? However, if you think about training an AI like this with this historical data, there is lots of evidence already that this actually doesn't work very well. And this is just snapshots of prior examples of how AI hasn't helped, particularly when you try to take it from the academic laboratory or from a closed-in, let's say, test cell training set, and you're trying to release it in the wild, as we say. Now, one of the reasons why this is happening is because AI systems tend to be susceptible to bias. Let me show you an example, fabricated, of how such a bias may arise. So let's say using this previous example, it was identical as the one before, but now we will take a pocket of the population that for some reason we will say they do not like to go to the hospital. They do not like to go to their GP. They do not trust their GP. They may feel discriminated. So suddenly they do not go to the hospital. They go when things are much, much worse. Suddenly, if we train all this historical data, we are associating the patient characteristics, these protected characteristics, with worse outcomes. It has nothing to do with biology, has nothing to do with them, just because they're just going later. We're effectively learning on a correlation, right? And that's not good. Because if you think about correlation, it's very easy to find it. I don't know how many of you like mozzarella, but that doesn't make you want to become a health professional, right? The more you grow the data, the more you grow the dimensions, the easier it is to find correlations. So what can we do? Well, there is some hope in what we call causal AI. So it offers a step change, actually. So it helps us understand how data are generated and what are the implications on the assumptions and the approximations we make. So let me build on this example. So we know, for example, that pelvic fracture, it is a cause for future disability. But there might be other things that actually confound this relationship, right? Now, causal AI actually is the only methodology that is actually can understand the causal influence of these paths. It can not only ensure fairness, but actually improve our understanding of health, improve our understanding of biology, improve our understanding of disease, improve our understanding of health pathways. And actually, it is the only way that we can start thinking about making recommendations to treatment, maybe suggestions to treatment, and even evaluate policies as a whole. So we truly believe that causal AI can offer a step change in what we can do for AI, and particularly for the healthcare sector. Now, this is not something that we started yesterday. We've been working very hard over the last few years, particularly with joint collaboration with the industry, actually, with Canon Medical. This is an example of some of the work. So we've written opinion articles about how causal machine learning can help healthcare, in particular within precision medicine, as well as some really groundbreaking work in solving some fundamental problems within causal inference. So we worked, for example, on how you can learn causal relationships from large-scale data. We have the first method that can work in more than 1,000 variables, very fast because we rely on generative diffusion models. But we also think about how we can benchmark counterfactuals. Counterfactuals are very useful when considering what-if scenarios, and you see what you can do, particularly for validating algorithms and verifying that they're working very well. However, we very quickly realized that that's a problem. There is a lot of difficult problems to solve, and one cannot, both of us, both the industry partner and myself thought we have to grow bigger, we have to work more. And this gave birth to basically Chai, a place where we can devise solutions co-created with an ecosystem. Chai is something that I lead here at the University of Edinburgh, but is actually has multiple partners across the UK, in Manchester, King's, UCL, Exeter, and Imperial. We are majorly funded by EPSSC with £12 million. We have an additional 1 million from industry at the moment, and we have a significant amount of in-kind, and we keep growing. We have 3 new partners signed up since we started 2 months ago. Our vision, of course, is to do great things and be great. But fundamentally, I think is training a next generation of AI scientists, clinicians, experts that think about in a different way, but working all together. Chai has 3 major pillars. One is about user engagement, one about solving fundamental research challenges, and one about dealing with real data exemplars. So just a picture of our current ecosystem. We have worked very, very hard already to be able to bring together not only policy, not only government, but a lot of industrial stakeholders, some of which actually you will meet today in the room, and hopefully we will be able to share a drink later tonight. We address major research challenges. It's very easy to do them in theory, but it becomes extremely interesting when you're trying to tackle them, of how you can solve practical problems with complex real data within the traditional setting of how data are shared within the UK. And of course, we work on healthcare data. And we have collected a large set of exemplars dealing with all the great healthcare challenges within the UK and globally. I'm not gonna give you all of the examples, but I'll just pick one, for example, on dementia. We're working on a large consortium, leveraging already their work, and then we come after as a way to be able to practice causal AI on the data collected within the whole population of Scotland. To conclude, I think we do have a great opportunity that we can address causal learning, which we believe is transformative for realizing robust and health-safe AI. We have already 50 organizations and 80 affiliated researchers. We operate a hub-and-spoke model with spokes also in London and Manchester, so there will be a causal AI expert almost anywhere very, very near to you. And we do address methodological gaps with immediate need in healthcare and NHS partnerships. If you're still interested in coming back to Edinburgh next week, or if you're interested in staying on Teams, our launch event is on next, there is some delay, Thursday. You can follow our website, or you can take a QR code picture. I can be in the picture too if you want, so you remember. Anyway, thank you very much for your time.